Yamama kwaba edemoba Aboro TV so. Na enra yekopie mu ewo Bono East Region Tachiman municipal ho na yekopie na dwumadi aye Ghana Health Service ahyehye se wo besoso mmofra num mmofra wadi eye bosome baako mienu ekopen wona wanya emfie enum anum no se be ya yade kwankro bi entimi enka wonto abra woye mmofra no na yekoye no yeni opanyimpa wadano eye Dr Ofosuhene kusi wano ene ye panyimba wadano ene Abolo TV etwetwe nkomo yenti nkoma one yen etwetwe ye no.
My advice to the parents: look, if the immunization is for children from 0 to 5 years or 0 to 59 months, whichever is applicable. So let's take advantage. It's a free exercise. Polio has been done for years. It's a safe vaccine. There is nothing untoward about it. I mean, in fact, it's for some few countries who didn't want to vaccinate their children. They ended up with wild polio in Nigeria, Pakistan, and the rest. So we don't want to go back to the polio days. So we will appeal that everybody should avail their wards or their children for the vaccination exercise. And for the health workers, I would really want to commend them and tell them to keep up the good job they've been doing so far. I mean, yesterday I was amazed to see people walking through the rain to vaccinate children, and it's very, very encouraging. So I tell them to keep up the good job. Thank you very much. The major challenge with regards to this polio immunization exercise has been the vehicular support and the motorbikes especially, because if our community health nurses and our health facilities had all these motorbikes to make the program much easier to run, because then they fill their motorbikes and they can get into the various cottages and villages. But now sometimes they have to wait for Pragia, take a motorcade, or sometimes even walk. So it kind of slows down the exercise. And the other challenge was to do with social mobilization. We have what we call social mobilizers who are from the community. Unfortunately, some of them are making extra demands in terms of allowances, which unfortunately we were seeing it more as a volunteer work. But we've also in subsequent exercises, we'll see how we can partner with other groups to solve that problem. I'm lucky to be in the midst of Rotarians, so maybe my advice to the parents: look, if the immunization is for children from 0 to 5 years or 0 to 59 months, whichever is applicable. So let's take advantage. It's a free exercise. Polio has been done for years. It's a safe vaccine. There is nothing untoward about it. I mean, in fact, it's for some few countries who didn't want to vaccinate their children. They ended up with wild polio in Nigeria, Pakistan, and the rest. So we don't want to go back to the polio days. So we will appeal that everybody should avail their wards or their children for the vaccination exercise. And for the health workers, I would really want to commend them and tell them to keep up the good job they've been doing so far. I mean, yesterday I was amazed to see people walking through the rain to vaccinate children, and it's very, very encouraging. So I tell them to keep up the good job.
Na yewie ya na eye maame Benedicta eye Bampala wono nso na ye president elect Emma the Rotary fan club Tachiman branch wono nso de ensem eto Abolo TV anim okire mu se won de wonasade ne se wobeso aban nasen na apomuden adwuma biara esese wo manfo no wonya no wonso wode wo moa ne wahoɔden aboayen ensem sei na maame Benedicta wono nso wode to ye Abolo TV ensentwerefo anim.
So this morning we are from the Rotary Club of Tachiman, and then as you know, this is our polio month worldwide. So this morning the Rotary Club of Tachiman, in partnership with the Health Directorate of Tachiman, are here to see how the exercise is going on. So we already joined the health workers who are in the communities administering the vaccine, and it's really going on well. I like to really advise parents to really avail themselves for this exercise. The exercise is targeted from kids from 0 to 5. And you know, in our society, they are very vulnerable. So we plead that parents and community leaders should all get involved and avail themselves for this exercise so that we can together eradicate polio.